Hello and welcome to this month's episode of the Dentistry Gym. So in partnership with dentistry.co.uk, we've made these free online classes to help dentists and, well, to be honest, to help everyone or anyone get stronger, get more mobile, help deal with pain, help prevent injuries and things like that. So if you like this content, please subscribe, give it a thumbs up. For today's episode, we'll be focusing a lot of stuff in the sitting position because a lot of dentists, they sit down, so that you can utilize any of these sort of exercises or techniques throughout your day or between patients to help feel a little bit better, help you feel a little bit less pain, maybe a little bit less tension, things like that, okay? If you want to, you can do them all in a row in a class. These classes are designed to be done with minimal equipment and also just using mainly your body weight. The goal of these classes is to help you get stronger, to help you improve mobility or flexibility, and just to help you feel better in general and get more control over your body, okay? So, as always, we're gonna start with a nice gentle warm-up, all right? So we're gonna start with the neck and the mid-back. So if you've been following these classes for a long time, you know we do the CARS exercises to warm up. So if you don't know what those are, I'll put a link up here or somewhere, and that's gonna take you to some of the CARS videos so you can practice those. Ideally, I'd like you to practice those every single day because doing CARS is really beneficial for your joints, really healthy, or it's kind of like flossing your teeth every day. It keeps them nice and healthy, yeah? But anyway, let's get into it. So first thing we do is a nice little gentle neck CARS. So what we're gonna do is sit nice and tall, okay? From here, you're gonna tuck your chin down. Imagine you're gonna crush your Adam's apple, or imagine you're gonna put your finger here, you're gonna crush it like that. So if I turn to the side, we're doing this action, okay? So when you do it, it's not this, it's this first. So tuck that chin, bring the nose down towards the chest. Then we're gonna rotate to the right-hand side, drop the ear behind, look up to the ceiling, be mindful of any pinching pain, just avoid that. All the way to the other shoulder, tuck that chin, bring it back down. Reverse to the left shoulder, drop the ear behind, look up as high as you can, all the way to the right shoulder, tuck that chin and back to the middle. Reverse again to the right shoulder, drop the ear behind, look up, all the way to the left shoulder, tuck it in again. One more time, reverse to the left hand side. Try to imagine you're moving at 1 mile an hour, keep it nice and smooth. Don't sort of like have a seizure when you're doing it. Okay, and back in. All right, so that's the neck done. Now what we're gonna do, you're gonna love yourself and you're gonna give yourself a nice big hug. So arms are gonna cross like this. And then what you're gonna do from now is you wanna drive those elbows into your ribs, okay? So when you do it, you're trying to crush the ribs and you're trying to round the upper back, okay? So here, and then what you're gonna do, keeping those elbows pinned down onto your rib cage, you're gonna draw a nice big circle. So when you're doing it, make sure you don't do this, okay? So the elbows, there should be no gap between you. If you're struggling, put something in there like a towel, and that can help squeeze that towel, okay? So crush the ribs, slouch down, so you can see from the side. From here, you're gonna rotate to the right-hand side. So as I'm doing this, my whole body is not moving with it, okay? It's just my upper back. So rotate that way, drop the shoulder, start to arch the back. Remember, when you do this, don't lift the arms. Keep the elbows nice and tight towards the ribs. Extend, extend, extend. Rotate to the left-hand side, drop the left shoulder, and then complete the circle. Let's reverse. Rotate to the left, drop the shoulder down, extend, arch up. When you do this, be mindful not to lean back. Okay, try to extend like that. So extend the upper back, rotate to the right hand side, drop that shoulder and then back down. Okay, one more time. Crush the ribs, rotate, drop the shoulder, extend, 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 rotate, rotate, drop that left shoulder, back down, and one more time, reverse, rotate, drop the shoulder, extend as much as you can, squeeze those muscles, rotate, 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 drop the shoulder, and then back down. Cool. Last one, shrug the shoulders, pull them back, pull them down. So when you do this, imagine you're gonna punch the ground as hard as you can, punch the ground. Now you're gonna push forward, shrug as close to your ears as you can, pull them back, punch down, forward, up, back, down. You should be feeling the muscles working. If you don't feel the muscles working, push a little bit harder, okay? And try not to bend the elbows, so try and don't do this, okay? We're not doing no chicken dance, all right? So, that's our warm-up done. So now we're gonna move on to the exercise. Again, you can do these between patients, you can do these end of the day, beginning of the day, it doesn't really matter. You can pick 1 or 2 exercises, whichever ones you want, or you can do them in a row as a class. All right, so the first one's pretty simple, most of you have seen this. you're gonna grab one leg, you're gonna place it on like that, okay? If you cannot do this, then you need to work on this, all right? So if you can't do this, if you can't bring your leg up like that, if you're like this, okay, you just straighten that leg out a little bit, okay? So you bring that leg down, makes it a little bit easier, okay? If you're better, you're here. If you're really good, place your foot up on something, all right? But from here, try to be nice and tall. So from the side, I'm like this. Now what you're gonna do from here is try to create a little bit of an arch in your lower back. So stick your butt back. Okay, you're gonna feel a nice stretch through here. As you do that, be nice and tall in your spine, start to lean forward until you get to the end of your stretch, okay? So don't do this. Nice and straight, arching the lower back, lean forward, okay? And now you're gonna hold that stretch. We're just gonna stay here for about 30 seconds to a minute, all right? Work on your breathing, nice and relaxed, okay? As time goes on, keeping that arch in your back, lean forward a little bit more. As you go further into the time, you're gonna find that you can get a bit deeper, and you wanna get a bit deeper. You wanna go a little bit more so that you can get further into that stretch. So, leaning forward, nice stretch, holding, holding, holding. If you get numbness in this foot, just take your foot off, shake it off and start again, okay? So leaning forward, finding that nice little stretch, okay? If you want to, you can put a little bit of overpressure here, or if you want to be really mean, start to pull up here like that. Okay, leaning forward, holding, holding, holding. And now we're gonna do the PAILs, all right? So this is a common occurrence in all the videos. So what a PAILs is an isometric exercise. So essentially what you're gonna try and do is take your top leg and you're gonna try to push your top leg into your bottom leg, okay? So what you're actually trying to do is you're trying to do this motion. So you're trying to push like that, okay? So from here, find your stretch. Now, top ankle, you're gonna start to push down into your bottom leg, okay? As if you're trying to drive a hole through this bottom leg through here, okay? You're gonna feel your butt muscles start to work, all right? At the same time, take your right hand and start to push that knee up into the right hand and push this down. So this goes down, this goes up, yeah? So pushing up with that right knee, pushing down with that. You should feel the muscles in your butt working, you should feel a little bit through here as well, okay? So holding that, start to push, increase how hard you're pushing. You start with say 20%, increase, 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 that's it. Go 30, 40, 50%, push hard, push hard, push hard. Really push hard, lock that elbow in place, push, 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 push. Now you're at 70%, you should be working quite hard. Push, push, 5, 4, 3, 2, and slowly relax. Don't lose the stretch. Now again, nice arch in the back, sink forward more, sink, sink, sink. Find that new stretch. Staying nice and tall in the spine. Imagine there's a rod in your spine, okay? All right, now you're into the new stretch. We're gonna go again. So staying in this position, push down here, push up here, okay? If you find that really difficult, you can place your elbow on top like that, all right? Push, 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 start with 20%, 30%, 40, shh. It's a dog outside. 50%, 60, push hard. Come on, you should be working hard. Push, 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 push. 5, 4, 3, 2, and slowly relax. Again, now sink further, sink deeper. Remember, nice and straight in the lower back. Arch the back, stick your belly button forward. Sink deeper, sink deeper, sink deeper. Good. Hold that stretch for a little bit. Just relax in here for a little bit. Good. And then now slowly come out. Go onto your left leg. Bring that up. So my left leg is a little bit tighter, that's okay. So here I feel a stretch like right now, okay? Which is fine. You don't have to, if you can't lean forward, that's perfectly fine. Remember what I said? If you're really struggling, straighten that leg out, let the leg drop down, and then you can come forward a little bit more, okay? So here, sink forward, belly buttons forward, nice and tall in the spine. This hand is here. Wow, that dog is really not happy. Okay. Hold the stretch for a little bit. We're gonna go about 30 seconds, 45 seconds. Remember, keep breathing, sinking deeper as time goes on. Sink deeper, deeper, deeper. That's it. Good. Go a bit more. Hold that stretch. Be mindful not to make sure you don't feel any pinching pain here. You should feel a stretch on the side. If you don't feel stretch on that side, you feel pinching here, then message me on Instagram. Okay. So now we're gonna go for the isometric again. Remember, pushing down with this leg, pushing up with this knee. Okay, so the knee goes up into the hand, foot goes down. Try to make a dent in this bottom leg with your foot, okay? Start with 20%, give me 30%, 40, now we're gonna squeeze the opposite fist, squeeze. Now push harder, come on. Give me 60, 70%, push hard, hard, hard. You should be feeling the muscles really working now. Push, 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 push. 5, 4, 3, 2, and slowly relax. Again, sink a bit deeper, nice and tall in the spine. Find a new stretch. Good. And now we're gonna ramp it up again. So let's go 20%, push down, push up. Okay, 20%, 30%, 40, keep breathing, let's go 50%, 60, squeeze the other fist, push hard, give me 70% of your maximum, come on, push, 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 5, 4, 3, 2, and 1, slowly come down, now sink it deeper into that stretch. Okay, nice and tall in the spine, try to think of pushing your belly button forward, nice and tall in the neck as well, hold it, hold it, hold it, good, and come out. Whew. All right, shake the legs off. All right, so the next thing we're gonna work on is the lower back, okay? So again, you can do this in a sitting position. It can help to scooch forward a little bit. So essentially what you wanna do is we wanna round the lower back as much as possible. So if I show you from the side, this is me normal sitting, then we're gonna round and kind of sink forward like that, okay? Once I've done that, I'm gonna take my hands underneath, okay, and I'm gonna clasp them together. You can do it like this, or you can do it like this, okay? Ideally, you want to be feeling a stretch. If you can't feel too much stretch, if you're quite flexible already, then you can reach down towards your toes and then grab onto your toes, but you need something to hold on to. So from here, you're going to slouch forward, you're going to come through, you're going to clasp the hands like that, and then you're just going to try to sink and try to get a bit of a stretch, all right? So from here, we're not going to spend too long in this position. From here, what you do is lock your arms in tight, so grip them up like that, right? Grip them nice and tight, and what you want to do is you want to try to sit up, and what's going to happen is your hands are going to stop you from sitting up, and you want to feel the muscles of the lower back working. All right, don't go too hard with this, especially if you have lower back pain. Start really small. Don't go up to the sort of 60 or 70%, just go up to say 20 or 30%. All right, so clasp onto the hands like that, make them nice and tight. Start to sit up tall. You can even lift your head a little bit. Try to think, imagine you're going to try and raise your chest up towards the ceiling. Okay, keep pushing, pushing, pushing. Try to raise that chest up, try to sit up nice and tall. Bring the shoulders back. That's it, hold it, hold it, hold it. Say go 40% effort, increase, go a little bit harder. You really want to feel the lower back muscles working. That's it, hold it, hold it, hold it. 5, 4, 3, 2, and 1, relax. Now, if you started here, try to go to here. You started here, try and go to here, or go into your hands. The idea is you want to try to bring your hands in closer so that you're stretching a bit further. All right, so I was here, so I'm going to try to go here. All right, so I'm there, grip my hands a little bit tighter. Okay, again, start to look up, lift the chest up, try to bring the shoulders back, try to sit up tall, lock those arms in place, feel the lower back working, breathing. It's a lot harder than this way. That's it, keep going, keep going. Try to sit up tall, feel the lower back muscles working. Pull, 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 pull. That's it, another 10 seconds. Breathing. 5, 4, 3, 2, and slowly relax. Okay, now we're just gonna stay here. We're gonna feel a nice little stretch in the lower back. Okay, if you want to, you can straighten the legs out a little bit. You're gonna give a bit of a hamstring stretch, okay? The idea is you wanna try to stretch the lower back out a little bit, okay? Try and put your hands onto the floor, and then just hang out here for a little bit. Okay, getting a nice big stretch in the lower back. Drop your head as well. And come back up. Good. So the next thing we're gonna work on is for the mid back, all right? With this, you're gonna place your hands behind your head, like this, being nice and tall, all right? When you're doing it, all right, try not to lean back too much, all right? But from here, nice and tall, lock the ribs in place. So when you're doing this, you don't wanna be arching the lower back, okay? Keep those ribs nice and tight, tense the abs a little bit, hands behind the head, and then what you wanna do is you wanna pull your elbows back like that, and then try to reach your hands back as far as, imagine you're trying to get like a ball or something over your head and you're going to throw it that way. Okay, so elbows back, reach the hands back. So I'm trying to reach into that direction with my hands. From here, start to straighten the hands, reach as far back as possible. Remember, don't arch, the abs tight, reach as far back as possible. Okay, then bring the hands back, relax, elbows back, reach the hands back. So I'm lifting them off my head. Now keeping them back as far as possible, elbows as far back as possible, reach back, reach back, reach back. Okay, and then come back, elbows back, hands off the head, reach back, reach back, reach back. Be mindful, don't arch, don't sort of put your head forward as well. Reach back, reach back, reach back, come back. Okay, 2 more times. Elbows back, hands off the head, reach back, hold, 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 hold. Last one, okay. Elbows back, hands off the head, reach back, reach back, reach back, reach back as far as you can. Squeeze, 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 squeeze. 5, 4, 3, 2, and relax. Okay, so what I would suggest is to do those exercises again whenever you feel like it. They're all for certain things. So if you feel like maybe your upper back's a bit tight, you can do the last exercise, okay, maybe between patients, get some blood flowing into that area, make it feel nice and good. If you're feeling a bit stiff, then do the calves exercises between patients. If your lower back's a bit tight, you can do a little bit of the isometric PAILs. If your hips feel a bit tight and your lower back, you can do the glute stretch. So it kind of targets all of the different areas. The last thing we're gonna finish on is what's called segmenting. So segmenting just means that we're trying to move segment by segment, okay? There's 24 vertebrae, all right, from here to here. Yes, 24, I should know that. Yeah, 24 vertebrae from your head down to your bottom, all right? And is it 24? Yes, there is 24. God, I should know these things. But yeah, there's 24 vertebrae. So what you're gonna do is we're gonna take each one of them into a range of motion. So it looks a bit like this, all right? So from here, what you can do is you're going to slouch down, okay? And then we're going to start from the lower back. So from here, tilt the pelvis, so let the belly button go forward. Now from here, now from here, now from up, up, up. Start taking the chest forward, chest forward, chest forward. Bring the head up, start to look up to the ceiling. Okay, now tuck the chin. Now let the shoulders drop. Keep the lower back nice and tight. Upper back. So when you're doing this, don't just flop. Keep the lower back nice and tight. Move the upper back. Think about caving the chest in. Okay, now the lower back, start to round it. Okay, and again reverse. Tilt the pelvis. Belly button forward. Bit more belly button. Stick the ribs up. Start to arch the lower back. Start to straighten up the chest. Shoulders back. Head up. Look up to the ceiling, reverse, tuck the chin, nose towards the chest, lower back tight, drop the shoulders, cave the chest. Now start to relax the lower back and then go in like that. Okay, so you can see if I go a little bit faster, we're trying to go segment by segment, just like that. It really pays to concentrate and try and do it nice and slow so you can feel each of the muscles in the joints working. Good. So that's a really good one to help get more motion to your spine. I advise doing that between patients regularly as well as doing your normal calves routine. But thanks for this joining us though. Thanks for joining us for this month's episode of the Dentistry Gym. So give it a thumbs up, subscribe for more content. We're doing this every single month. And you can go back and check out some of the old videos. I'll put a link up over here. And you can check back on the old classes. You can do those. Again, you can do these between patients. You can do them as a full class, whatever it is. The idea is that it's going to help you become more flexible, stronger, and help you with pain and help you with any injuries. Thank you. See you next month.